Ask if I can really quickly about as it relates to Novavax and to AstraZeneca. The White House said that it would be providing 60 million doses to other countries. Has the administration communicated to AstraZeneca or to Novavax that they don't need to rush ahead in their effort to get a EUA right now, in that you're going to be giving it elsewhere?
Well, first, I think we see that as a separate process. They have not applied for an EUA, and nor obviously have they been granted one. We also have ordered 300 million doses from AstraZeneca, which we certainly expect they will deliver on. So we will evaluate. What we're talking about here is, and the reason the 300 million is relevant is because we're talking about 60 million here, 10 of which we expect and hope will be through the FDA review in the next few weeks, and the 50 million in the next few months. But they will decide when they apply for an EUA. We're talking about doses that have not yet been approved that we are going to supply to give to the global community.
Thanks, Jim.
Go ahead.
Sort of a broader, all of government kind of question.
I want to start with a follow-up on the COVID vaccine, specifically the AstraZeneca doses that are going abroad. I want to clarify something you said yesterday about COVAX. And can you just say whether the U.S. is considering distributing those doses to other countries through COVAX, or are you only focusing on distributing them on country-by-country basis directly?
We expect it to be a combination. We're still developing our plans and what that looks like. And again, as I alluded to earlier, we're talking about 10 million doses if it goes through FDA review in the next few weeks. So it's not today. We have 0 doses available today, and then another 50 million in several months. So we have some time to develop what our plan is and meet whatever the needs are at that moment in time.
And then
one more on behalf of Radio Pool. Is there an update on whether the U.S. will support the special waiver to waive vaccine patents at the WTO so other countries can make generic versions? Of course, there's a meeting at the end of the month.
And I know that our ambassador, our USTR, spoke to this. So how we're looking at this is our focus is on maximizing production and supply for the world at the lowest possible cost. And there are a lot of different ways to do that. Right now, that's one of the ways, but we have to assess what makes the most sense. So, for example, we produce a lot of vaccines here in the United States, right? Vaccines, manufactured here. We have manufacturing facilities that have been through, a number of them have been through FDA approval or going through FDA approval. We have to evaluate whether it's more effective to manufacture here and provide supply to the world, or the IP waiver is an option. There has not been a recommendation made from USTR, nor has the President made a decision.
And one more follow-up on that topic. What will go into deciding which countries get our excess vaccine?
Well, expect it will be a combination of our COVID team working with our national security team, our team at the State Department, to determine where the requests are, where the needs come in, where the needs are in order, and when we can be the most impactful on helping get the pandemic under control. And there is a process ongoing now. Again, we'll have about 10 million doses we expect, hopefully, if they go through the FDA review in the next couple of weeks, and then an additional 50 several months from there. Go ahead.